Moving on to some medical news, there is a groundbreaking new test for patients with fatal blood cancers like leukemia. Dr. James Ferrara is with Mount Sinai Hospital, and he's the lead researcher in this particular study. And he's joining us here in our New York studio. Dr. Ferrara, hi, how are you?
I'm well, thanks.
Very
how
nice
are you?
to meet you. Thank you so much for coming in. I think when people think of blood cancers, if they are aware of what they are at all, they automatically think of leukemia, but that's just one.
That's just one. It's a primary one. There are also lymphomas, and multiple myeloma is also a blood cancer. Blood cancer is any cancer of a blood-forming cell that usually lives in the bone marrow, which is the factory of the blood. So if you have a cancer, it's like putting out defective cars. Suddenly, you don't have enough of your normal blood cells to take care of infections or to keep oxygen going to your brain or to the other tissues of your body. So it affects all of the tissues in a human being.
Are there particular groups that are overrepresented in blood cancers or risk factors?
Well, there are certain genetic risk factors, and most blood cancers occur in patients who are in their 50s, 60s, and 70s. So it's actually a problem of genes. There are some genetic risk factors, but as we get older, we have a slow number of mutations that happen normally. And if you're unlucky and those mutations happen to collide, you wind up with a blood cancer.
And is there good screening for blood cancers?
There is some, but usually you don't pick it up. You won't pick it up from a normal blood test. You've just got to keep going to your doctor for your regular checkups for that.
And as it relates, I think this relates to some of the research you're doing. Let's talk about some of the treatments that are available.
Right. So any blood cancer would be treated with chemotherapy to start with, but only about half of blood cancers will be cured with chemotherapy. And in those cases, you would need a stem cell transplant or a bone marrow transplant. Those two terms are interchangeable. If you get a bone marrow transplant from somebody who's not yourself, from a sibling, for example, or from an unrelated volunteer, we call that an allogeneic bone marrow transplant. And when you do that transplant, it's not only the stem cells, but the immune system from the donor, the normal immune system, that can come and help eliminate the leukemia or the cancer. That's the good news. The bad news is that sometimes that normal immune system can't distinguish between the cancer cell and the normal tissues. And that's the complication of bone marrow transplantation called graft versus host disease. And that's what this new test is about.
Okay, so how is this graft versus host disease then addressed or treated?
Right, so actually the treatment for it is still fairly primitive. It's high-dose steroids, and that further suppresses the immune system, which is the last thing that you want to do. We do it only because we have to stop this graft versus host disease. But this test can now tell us when the GVHD, or the graft versus host disease, is going to be mild or severe, so we can tailor the treatment to the patient.
And that is why it's so important.
And that's why it's important.
All right, Dr. James Ferrara, thank you very much for that great explanation.
Thank you.
Nice
it's been a pleasure.
And you're watching Rise America.